Okay, now we would like to begin our recording session. Hello and good pleasant day to all viewers and especially to Dr. Rania for SEBB2513 Basics Rehabilitations. We are from Section 2, Group D for Option 2, entitled Smartwatch in Integrating of Telerehabilitation for Compulsive Obstructive Pulmonary Disease COPD. My name is Muhammad HARIST bin RAJUNA with JUNAID, SUSSVINDERJEET, and also NOOR FATIHA. Now, I would like to pass the mic to ALIA.
So, hi. By starting to introduce what is actually chronic obstructive pulmonary disease, or well known as COPD. So, COPD is a preventable and treatable disease that characterized by airflow limitation that is not fully reversible. The airflow limitation is usually progressive and is associated with an abnormal inflammatory response of the lung to noxious particles or gases. People with COPD have exacerbation when their breathing, cough, and sputum production worsen, and treatment is warranted. Smoking is the main cause of COPD and is thought to be responsible for around 9 in every 10 cases. The harmful chemical in smoke can damage the lining of the lung and airways. And other than that, exposed to air pollution, working with chemical, dust, and fume, and a history of childhood respiratory infection are also the cause of COPD. Next slide. So, with COPD, how COPD will affect the lung? The airways in our lung become inflamed and thicken, and the tissue where oxygen is exchanged is destroyed. Because of that, the airway of the lung, which is bronchial tube, become inflamed and narrow, and can cause an overproduction of fluid. This will lead to frequent and productive coughing by producing mucus and phlegm. It will unable to efficiently move oxygen from the air to the blood. So it can lead to destruction of the alveoli, the tiny air sacs that allow oxygen to get into the blood. Their destruction leads to the formation of large air pockets in the lung called bullae. Next slide. So, what the difference between healthy lung versus lung with COPD? So, first step, we need to know how it will be affect is to learn what damage from COPD looks like and why it becomes so hard to breathe. So, in the lung, the bronchial tube branch out into the thousands of smaller air passage called bronchioles, which have tiny air sacs called alveoli on the end. When we breathe in, this tiny sac will fill with the air and expand like balloons. When we exhale, they deflate again. This wall of the alveoli are lined with capillaries, so when air reaches these air sacs, oxygen is easily transferred to the blood so that it can be carried throughout our body. At the same time, carbon dioxide will move into the alveoli so that we can exhale it back when we don't want to in our bodies. So in emphysema, which is type of the COPD, the walls between the tiny air sacs are damaged, causing them to lose their elasticity and shape essentially become deflated. The walls may even completely break down. When the walls of the air sacs get destroyed, we end up with fewer but larger sacs. And since they have lost their stretch, air then gets trapped in the lung, making it harder to exhale. That's why people are more symptomatic as they are breathing out. Using a high-pitched whistling sound made while we breathe is caused by turbulent airflow as we trying to breathe out. In chronic bronchitis, the lining of the airways becomes constantly irritated and inflamed, causing it to swell and prompting thick mucus to form. So this implementation, excess mucus can obstruct normal breathing and often cause obstructive, which is chronic cough. It can also lead to recurrent infection. All of these structural changes in the lungs are what contribute to COPD, and as the disease progresses, symptoms will worsen as well. That's all from me. I will pass it to SUSSVINDERJEET.
Hi, I'm SUSSVINDERJEET and I'll continue with the next slide, which is the significance of our smartwatch. So, first of all, is to assist patients with COPD by keeping track with their health status in an easier way. It is very easy for them to track their data and everything because they can do it anywhere, anytime in their own comfort zone. Second is to ensure early detection of exacerbations from continuous monitoring of heart rate, respiratory rate, oxygen saturation, and physical activity. From this, they can detect their COPD status, or they can detect their health status in an earlier stage and get earlier checkup from doctor. And the third one is to increase acceptability of the usage of smartwatch and improve patients' experience in telerehabilitation. Since it's an easier way to track their data, and also patients might find using this smartwatch as a great assistive technology device for them. Next slide. So let's have a look for this International Classification of Functioning Model, ICF model, for COPD patients. For the impairment or disease is chronic obstructive pulmonary disease, COPD. And for the body functions and structure is shortness of breath during physical activities, tightness of lungs capacity in the chest, frequent infection of the lungs, frequent coughing or wheezing with or without sputum, and lack of energy and frequent tiredness. For the activities is walking and moving around, changing body position, lifting and carrying objects. And for the participation is outdoor activities and aggressive sports, travels outside and doing house chores. For the environmental factors that causes COPD is the air quality, which is air pollutants, occupational exposure, breathing secondhand smoke, and equipment and technology. And also for the personal factors that causes COPD is a genetic condition, which is alpha-1 deficiency, history of childhood respiratory infection, asthma, active smoker, and age and sex. Next slide. Now let's have a look for the Human Activity Assisted Technology, HAAT model for COPD patients. For the human that we are targeting is COPD patients with respiratory symptoms and muscle weakness. And the assistive technology that we came up with is smartwatch. And for the activity, they have limitation, and they are less likely to be employed and more likely to be limited in the type of work. For the context, we have three parts, which is environmental factor is due to the secondhand smoke. For the physical factor is due to the age and active smoker. And for the external factor is outdoor air pollution. Next slide. So this is the flow chart that we have created on how our smartwatch will be able to work and how patients will be able to track that COPD patients will be able to track their data in an easier way. So that's all from me, and I'll pass to HARIST to explain about our smartwatch. Thank you.
Thank you, Sus, and also ALIA FATIHA for presenting the introduction parts of COPD and also how we can the impactful the part of a smartwatch. So this is our goals of innovation for smartwatch by integrating telerehabilitation for COPD patients. By using Scratch, we are able to design a smartwatch that hopefully can help the COPD patient So this is our heart, where it related with cardiovascular system and also respiratory system. So in respiratory system, lungs and heart are work together because the heart will pump the blood through the lungs for oxygen and carbon dioxide to be exchanged. So this is our heart, and this is our heart, and this is our smartwatch. In our smartwatch UI, we have the clock itself and the date. So now it currently shows 10:36 p.m. on 25 of May 2022. By clicking this button, go onto the menu if in an app or on the time screen. So it also can go back to the main time screen on the menu. So in this display, we can see there's a 4+1 option in our smartwatch. The first one is the setting, where we can change the setting of our wallpaper. And then we have also the camera, integrated camera, where the patient of COPD patient can interact with the doctors in the hospital via video call. Next, we also have the notes and for the nurses and the doctor in the hospital to receive the notes from the COPD patient, where they can write using their hands or using the pen provided in the smartwatch. And lastly, there's also a music here to ease the patient if they have any problem to release the stress when they having COPD, having a system of COPD. So next, this is our example of screenshot of our designs. This is, if you can see, here is the camera where we can contact the doctor from the hospital. This is using the webcam from the camera. So in the since I said previously I said the smartwatch is having 4+1 option. The fifth option is the instruction of COPD system in the watch. So in this app, we include the nose and mouth anatomy, the trachea, the larynx, and also the lungs. We contains bronchi here. By clicking this human part, they can show what happened to the COPD patients. So this is a screenshot of our app, or what is COPD. So these are the 3D designs of a smartwatch using Tinkercad. So from the top view, we can see the button and the camera. And from the bottom view, here we also included the scanner of ECG, heart rate for the patient, so that the watch can save the data inside the phone and transfer to the hospital. So from the left view, we have the speaker, and from the right view, we have the volume regulator and also the main button. This is the watch is also included with the privacy security for the user itself. So now I would like to pass to Junaid to tell about smartwatch improvements.
Thank you, Harris. Now I will highlight a few improvements we have made on the smartwatch. The first of which is the improvement in functionality. We have improved the sensory feedback and the analyzation of data from the smartwatch. This allows us to monitor near continuous sensory data in real time. For the second improvement, we have added voice and video recognition for increased privacy and security. This will allow patients to feel much safer when sharing their data with the hospital, or just just inputting their data inside the watch itself. But the third improvement we have made is a longer battery life compared to other watches. This will allow them to use the watch for a greater amount of time without recharging. For the fourth improvement, we have added an alarm which will alert the patient whenever their heart rate or oxygen level is reaching dangerous levels. This will allow them to alert the hospital earlier so they can receive treatment whenever they go there. If they are unable to alert the hospitals manually, the watch will automatically call the ambulance. For the fifth improvement, we have added a built-in pulse oximeter, which will monitor the blood oxygen levels of the patient. This will allow them to view how much oxygen is reaching their muscles, because low levels of oxygen can have adverse effects on their health. Next slide, please. Now we will compare the heart rate and oxygen saturation level for a normal patient and a COPD patient. For normal patients, they have a normal heartbeat of 74 beats per minute. But for a COPD patient, they have 85 beats per minute. Numerous studies have shown that a higher heart rate may indicate an elevated cardiovascular risk in COPD patients with autonomic nervous system dysfunction. As for oxygen saturation level, the normal range for a patient is greater than or equal to 95%. For a COPD patient, the normal range is around 88 to 92%. This results in hypoxemia and hypoxia in people with COPD. Hypoxemia occurs when oxygen levels are lower than normal. Hypoxia occurs when organs are unable to properly receive oxygen. Therefore, they're unable to function due to lack of oxygen. Next slide, please. Next slide, please. Now I'll talk about the limitations of our smartwatch. The first of which is the amount of data storage in the watch itself. Since the watch is portable, therefore it has limited amount of space, therefore limited amount of storage, which is the data which the watch gains from the sensor itself. The second limitation is the small display, which is a hindrance to elderly people since they have trouble viewing or interacting with the device properly. Third limitation is the limited battery life. Since it's portable, the battery life also is limited. But however, with numerous innovations over the years, we can eventually overcome this limitation. As for the limitation of data storage, we can overcome that by integrating cloud storage with the watch. Therefore, the data can easily be uploaded regularly through the cloud. Next slide, please. As for task delegation, it's as follows. HARIST was in charge of creation of coding and functionality of the smartwatches as a telerehabilitation device for COPD patients using Scratch. As for me, I was in charge of designation of digital interface of the COPD patient, which was inside the Scratch itself, and the 3D design of the smartwatch in Tinkercad. SUSSVINDERJEET was responsible for the literature review of the designation of smartwatch in COPD patients using Scratch, and the 3D design of the smartwatch in Tinkercad. NOOR ALIA was in charge of the creation of flowchart for the smartwatch to detect abnormalities in patients using Scratch. Next slide, please. This is our proposed timeline, which was including the pre-phase, which was choosing an AT device, phase 1, which was importing the 3D device into Scratch itself, and phase 2, which was adding coding to the smartwatch, and phase 3 was what we're doing right now. Next slide, please. This is our milestone and Gantt chart, which indicates every stage of our development in the smartwatch. Next slide, please. As for the conclusion, we have decided that the smartwatch will be very beneficial to the medical industry and the biomedical community, especially in improvement of care of people with COPD, which will allow us to reduce hospitalization and provide patients with a practical way to monitor their conditions to detect early exacerbation. If you want if you have any questions or comments, please get in touch with our group. We'll be happy to guide you through this. Thank you. That's all from us.
Thank you. Thank you everyone for listening for our proposal for smartwatch in integrating telerehabilitation for COPD patients. We from Group D are very grateful for listening our presentation. Thank you everyone, and see you soon.